this is Dr. Annie coming to you from Couch Conversations Psychotherapy and Counseling. In today's video, we are going to be talking about cognitive behavior therapy, otherwise known as CBT. And you may have heard of CBT before in your research about therapy and trying to find a therapist in general. And we have talked about it a little bit in some of our other videos, but we decided to create an introductory video where we can really deep dive into CBT and talk a little bit more about the specific components of CBT. So first of all, CBT was created by Aaron Beck. And these days, a lot of therapists are trained in CBT or specialize in CBT. And, CBT has been found to be really effective with a range of symptoms and diagnoses. So that's one of the reasons why it is very commonly used. So what is CBT exactly? CBT is the premise that in a given situation, there are a set of automatic thoughts, behaviors, and emotions that come up in that situation for that person. So the situation can be very different. It could be, a worker who is trying to get ready for an important presentation. It could be a student who has a very important exam. Perhaps a person in a relationship who needs to tell their partner something really important. It can also come from the stress of, financial issues or any medical issues that are, a concern at this time. So really the situation can range in a lot of ways, but the common thread in CBT is that there are these sets of, thoughts or cognitions, behaviors, as well as emotions. So let's break it down a little bit more and try to understand, what do we do with all of this? Essentially, when you work, with a therapist, doing CBT, or, if you're trying to think about these ideas on your own, the first thing you want to do is really build awareness and identify what is happening for you in a given situation. This is going to look different for everybody, but essentially what you're doing is you're taking a snapshot of that situation and you're asking yourself, what was I thinking in that moment? What were some of the emotions I was experiencing? And then what were the actions or the behaviors that I took in that moment? And once you identify what those things are, the second thing you want to do is really ask yourself, was that helpful for me? Was that helpful in the way that I navigated that situation, or could I have done something different? So the second step is really going to be identifying, what are some of the places that you can intervene? Could you maybe take a look at your thoughts and ask yourself, were these thoughts helpful to me or not helpful? And can I maybe challenge them a little bit? Maybe ask yourself about what you did in that moment. Were those coping behaviors, positive coping behaviors, or were they maybe unhealthy? And then really getting in tune with the emotions that you experience, in those difficult moments. So we want to really identify what you can change. And then the last step is implementing that change. And that's where a lot of the hard work comes in, is when you're in a similar situation again, can you do something different? Can you do something that's going to be more helpful for you in that moment? And, kind of bringing this all together, the more awareness that you have and the more you can really identify what's going on for you in these situations, the better you're going to be able to navigate those same situations or similar situations in the future and make different decisions. Feel free to check out some of the other videos we have that deep dive more into thoughts, behaviors, and emotions. And if you have any questions about cognitive behavior therapy and how our Couch Conversations therapists utilize CBT principles in our treatment with clients, please feel free to contact us by filling out the Contact Us form below, and one of our therapists will get back to you. Thank you so much for giving us your time and watching this video, and we look forward to seeing you next time.